but I also wanted to congratulate the Cleveland Council of Black Nurses on celebrating 50 years of being the voice and the champion of Black nurses in our region. For more than half a century, you have supported and elevated nurses. You've improved healthcare. You've lifted lives of the underserved and vulnerable in our community. So thank you for all you do for your patients, for your students, for our community's health, and for each other, and for improving the representation of our region's caregivers. We know that patients have better outcomes, receive more attention, feel more connected, and are simply healthier when they receive care from someone who mirrors the population that they serve.
Absolutely.
We still have lots of work to do. While 13.6% of Americans are Black, just 6.7% of nurses in America are Black. And I can honestly tell you that less than 1% of individuals across the country look like myself and probably look like one of you in positions of leadership,
right,
really taking the top spot. And I probably can count on two hands how many nurses, how many females, how many people of color are leading $2 billion healthcare systems. Actually, let me count on one hand.
Right, yes.
So we are here today for a lot of reasons. To celebrate nursing, to recognize scholarship and award winners, to connect with each other, to share our experiences, and to kindle and strengthen friendships. We are also here today because back in 1972, a group of nurses led by Matilda Johnson saw the need for Black nurses to come together and form the Cleveland Council of Black Nurses. This came just after the formation of the National Black Nurses Association, which also happened here in Cleveland. Those groundbreaking nurses saw a need and they did something. Imagine if we can go back to 1972 and have a lunch like this with our nursing ancestors. And we chatted with them and told them what healthcare is like in 2023 for people of color. What exactly would they say? What would they say when we told them that life expectancy for Black people in America was still shamefully behind other groups, and that life expectancy was actually going down?
Right.
What would they say when we told them that Black moms in 2023 would die from pregnancy-related causes 3 times as often as other women, and that Black babies in Cuyahoga County die 4 times as often as white babies? What would they say when we told them that Cleveland was recently named the least livable place in America for Black women?
Yep.
What would they say when we shared with them the results of a recent survey of Black women in Cleveland, a survey that revealed the following appalling statistics about the interaction with the healthcare system? That 41% of local Black women were told that their health issues were not real or were made up. That 37% were pressured to get on birth control. That 34% will refuse medication for pain or for pain management. That 60% were spoken down to about their health or their symptoms. And that 36% had a provider refuse to provide any treatment at all. What would they say when we told them that people of color are still suffering more and dying more often from almost every healthcare issue out there, from heart disease to cancer, to diabetes, to stroke, to hypertension, to kidney disease, to mental health and addiction, to Alzheimer's? The list goes on and on. What would our nursing ancestors say? They would say that America's healthcare system is fundamentally broken. And they wouldn't just say do something, they would do something. America's healthcare system is broken and misdiagnosed and mistreated my mother. It took her away from me from leukemia when she was just 46 years old, and I was only 23 years old. America's broken healthcare system misdiagnosed and took away both of my grandmothers from breast cancer. America's broken healthcare system refused to listen to my baby sister and our family history, denying her a life-saving mammogram when she was 36 years old, and then stole her away from me from breast cancer before her 40th birthday. And America's broken healthcare system nearly killed me twice. I was pregnant and woke up one morning with the eerie feeling that I was knocking at death's door. In the ambulance, I drifted in and out of consciousness, sensing that I was transitioning out of this life. But something kept pulling me back. I was not done yet. I was diagnosed with preeclampsia, the pregnancy-related condition that is 60% more likely to strike and kill Black women.
Yes.
This is the disease that stole the life of Olympic gold medalist Tori Bowie when she was only 32 years old and 8 months pregnant. I was an educated nurse. I knew the symptoms of preeclampsia. I raised my hand and I tried to speak up, and my concerns were dismissed until I was in the emergency department fighting for my life. And I can honestly tell you wholeheartedly that I'm here today only by the grace of God.
Yes.
These experiences with America's broken healthcare system have only fueled me and determined me even further, fueled me to do something. I am a fourth-generation nurse. The blood of my nursing ancestors flows through my bloodlines. After my mother passed away, I began to feel her guiding me to do something, to fix our broken healthcare system from the inside. I moved from the front line as a practitioner into healthcare leadership. This is what propelled me into healthcare leadership. After my sister's tragic death less than 2 years ago, and I believe it was a preventable death, I was considering a move here to Cleveland to take the top job at Metro Health. And I researched the city and I learned of the tragic statistics, especially the least livable city ranking, and I knew I just had to come here. This was my calling. This is our calling. For our nursing ancestors, for my grandmothers, my mother and my sister, for our children and our grandchildren and their children, and for tomorrow's nurses. We must come together and do all we can to reverse centuries of healthcare disparities, to zero out the death gap, to provide easy access to quality and culturally competent care, including mental health care, to significantly improve the representation of our caregivers, to create a healthcare system that honors every individual, provides a seat at the table for everyone, and that allows all voices to be recognized and heard, to lift not just the health, but the wealth of everyone in our community. And I know that I'm not speaking from a unique experience. Many of you in the room know that when we speak up with such resolve and such determination and such ambition, we know full well that we will be dismissed, ignored, overlooked, muted, talked over, walked over, and talked down to. The critics and naysayers will say it is impossible. And I have to tell you, everyone, when I hear the word impossible, I always start to spell it out loud. I am possible. I am possible. Last week when we hosted our first ever Metro Health Multicultural Women's Health Fair and Empowerment Expo, and we only had just a few months to plan and pull everything together, we were told that women would not come downtown and show up. We were told that women wouldn't give up their Saturday. We were told that women didn't want to attend a healthcare related event. In so many ways, in so many words, we were told that this was impossible.
What?
Last Saturday, more than 3,000 women came downtown. They gave up their Saturday, and they joyfully attended what was the largest event of its kind in the history of our city, in the history of our county, in the history of our communities, in the history of Northeast Ohio. We recognized the glaring need for health equity in Cleveland, and we did something, and we will keep doing something. I'm asking all of you here today in this room, I'm deputizing all of you here today in this room to join in our calling. This is a call to action to zero out the death gap. No life should be lost by tragic tragedies. To reverse centuries of healthcare disparities. To achieve health equity. And to lift the health and the wealth of everyone in our community. Impossible, they will say, and I can tell you, impossible is just another log on my fire. Start by doing what is necessary, St. Francis said. Then do what is possible. And then all of a sudden, suddenly, what you're doing is possible and impossible. Thank you so much for inviting me here today.